Hi everyone, I'm Professor Sung-Kwon Myung from the Department of Cancer Biomedical Science, National Cancer Center, Graduate School of Cancer Science and Policy. This is the second lecture for Medical Terminology 2, and this is 2020 Spring Semester Clinical Oncology. Previously, last week, at the first lecture, I talked about the basic elements of a medical word, suffixes and prefixes, body structure, and also skin system. Today, I'm going to talk about digestive, respiratory, and cardiovascular systems. Okay, let's get started. So, the first one is Chapter 6, Digestive System. Key terms. Here you can see several key terms. Asymptomatic. So this means without symptoms. A means without, symptomatic means symptom. And defecation. Defecation means elimination of feces from the gastrointestinal tract through the rectum. Duodenal bulb is one of the upper duodenal area just beyond the pylorus. And endoscope, previously I talked about this terminology. This is the instrument consisting of a rigid or flexible fiber optic tube and optical system for observing the inside of a hollow organ or cavity. Here, endo means in, scope means the instrument for examining. Exocrine or exocrine. Exo means outside, outward. Crine means secret. So this is relating to a gland that secretes outwardly through excretory ducts to the surface of an organ or tissue or into a vessel. And friable. This means easily broken. Pepsin. This is one of the enzymes secreted in the stomach. And punctate. Punctate means having pinpoint punctures on the surface. Varices. This means tortuous dilation of a vein. Sphincter. This is a circular muscle constricting an orifice, such as the pyloric sphincter around the opening of the stomach into the duodenum. And now I'm going to talk about the anatomy and physiology of the digestive system. So the digestive system is also called the GI system, gastrointestinal system, which consists of a digestive tube called the GI tract or alimentary canal and several accessory organs whose primary function is to break down food, prepare it for absorption, and eliminate waste. The GI tract varies in size and structure in several distinct regions. So from the mouth, pharynx, esophagus, stomach, small intestine, large intestine, rectum, and anus. So here, this figure shows the anterior view of the trunk and digestive organs. Here, please look at one by one. Here, from the face, the start of the GI system, there is a tongue, a mouth. In the mouth, there is a tongue, a mouth, and the pharynx, esophagus, and goes to stomach and duodenum. Duodenum is the first small intestines. So duodenum, and then ileum. Before the ileum, there is a jejunum. So duodenum, jejunum, ileum, and here the first part of the colon starts from the cecum, and ascending colon, transverse colon, descending colon, sigmoid colon, rectum, and the anus. And also you need to look at the surrounding organs related with the GI system. For example, actually there is another digestive system, the liver, gallbladder, and also regarding the colon, there is a hepatic flexure near to the liver, and also there is a splenic flexure near to the spleen. Okay, now let's start with the mouth. The mouth is the process of digestion begins in the mouth, aka also known as the oral cavity or buccal cavity. This mouth is a receptacle for food. There are several parts: cheeks, lips, teeth, tongue, and hard and soft palate. The mouth is located around the oral cavity are three pairs of salivary glands which secrete saliva. The saliva contains important digestive enzymes that help begin the chemical breakdown of food. The food is broken down mechanically by the teeth and also chemically by saliva, and then formed into a bolus. This figure shows the sagittal view of the head, showing oral, nasal, and pharyngeal components of the digestive system. Here, from the teeth, and there is an oral cavity in the mouth, and you can see the tongue, and in the posterior part you can see the soft palate, and in the front part there is a hard palate, and also in the posterior part of the mouth you can see the uvula, and the food goes into the esophagus, and in front of the esophagus there is a trachea, which is one of the respiratory tracts, and also you can see the epiglottis in the posterior part of the throat, and also in the posterior part of the mouth there is a pharynx. First, teeth. The teeth play an important role in initial stages of digestion by mechanically breaking down food, which is called mastication, and into small pieces as it mixes with the saliva. The teeth are covered by a hard enamel, giving them a smooth white appearance. Also, there is the structure, the main structure, dentin. This is the main structure of the tooth beneath the enamel. And also, in the inner part of the tooth, there is a pulp which contains nerves and blood vessels. Also, the teeth are embedded in pink flesh tissue, which is known as gums, that is gingiva. This figure shows the structure of the teeth. In the upper part, there is a crown, and the lower part, there is a root. And as for the crown, there is a several layer. In the outer layer, there is an enamel, and also inside there is a dentin, and also there is a pulp, and surrounding the teeth there is a gum, which is also called the gingiva, and also there is a cementum in the deep side of the root, and also in the teeth there are many blood vessels and also nerve. And tongue. The next one is tongue. Tongue assists in this mechanical digestion process by manipulating the bolus of food during chewing and moving it to the back of the mouth for swallowing. The tongue aids in speech production and taste. There is this papilla, these rough projections are on the surface of the tongue, which contain taste buds. There are 4 basic taste sensations registered by chemical stimulation of the taste buds: sweet, sour, salty, and bitter. And recently, the umami is added for glutamate, MSG, monosodium glutamate. And all other taste perceptions are combinations of these 4 basic flavors. The sense of taste is intricately linked with the sense of smell, making taste perception very complex. Here, you can see the structure of the tongue. Here, posterior part of the tongue, you can see palate papilla, and there are several fungiform papilla. If we enlarge the palate papilla, you can see the taste buds. Actually, there has been the tongue map myth. In 1901, a German scientist, D.P. Hanyu, published the tongue map based on the relative sensitivity on the tongue for the 4 non-basic tastes. So, for example, bitter in the posterior part, and both sides there are sour taste, and also in front of the sour taste area there are salty areas, and on the tip of the tongue there is a sweet taste area. But 1942, Edwin Boring, a psychologist historian at Harvard University, calculated real numbers for the levels of sensitivities and plotted them on a graph in such a way that other scientists assumed areas of lower sensitivity were areas of no sensitivity. But in 1974, Virginia Collins found that there were variations in sensitivity to the 4 basic tastes around the tongue, but small and insignificant. And found that all tastes can be detected anywhere there are taste receptors. So each taste area is found to be the myth. And now I'm gonna talk about the pharynx. As the bolus is pushed by the tongue into the pharynx, which is a throat, it is guided by the soft, flesh, V-shaped structure called the uvula. The pharynx serves as a passageway to the respiratory and GI tract and provides a originating chamber for speech sounds. There are 3 parts: nasopharynx, oropharynx, and laryngopharynx. And also, the lowest portion of the pharynx divides into 2 tubes. One that leads to the lungs, called the trachea, and one that leads to the stomach is called esophagus. And also there is a small flap of cartilage which is called the epiglottis, which falls back to cover the trachea during swallowing, forcing food to enter the esophagus. At all other times, it remains upright, allowing air to freely pass through the respiratory structures. This figure shows the pharynx, the structure of pharynx. So here you can see the 3 parts of the pharynx. The first one is green one, nasopharynx, and the yellow one, oropharynx, and the blue one is the hypopharynx. Now I'm going to talk about the esophagus. Esophagus is American English, or if you add the O in front of the esophagus, that is British English, esophagus, but the pronunciation is the same. It is commonly known as the food pipe or gullet, and its size is usually 18 to 25 centimeters long. And the esophagus consists of a fibromuscular tube through which food passes, aided by peristaltic contractions from the pharynx to the stomach. And during swallowing, the epiglottis tilts backwards to prevent food from going down the larynx. And also there is an important structure which is called the lower esophageal sphincter, and the abbreviation is LES. This is the terminal part of the esophagus, which is composed of muscle fibers that constrict once food has passed into the stomach. This prevents the stomach contents from regurgitating back into the esophagus. So you can see the esophagus and stomach, and in the distal part of the esophagus, you can see the LES, lower esophageal sphincter. And also there is the upper esophageal sphincter from the first part of the esophagus. And now we are going to the stomach. The stomach is a sac-like structure located in the left upper quadrant of the abdominal cavity. The stomach serves as a food reservoir that continues mechanical and chemical digestion. The stomach extends from the esophagus to the first part of the small intestine, the duodenum. The body of the stomach, the large central portion, together with the fundus, these are the many storage areas. And also there is a pylorus, which is the funnel-shaped terminal portion. So most digestion takes place in the pylorus. And also rugae in the mucosa, numerous macroscopic longitudinal folds that gradually unfold as the stomach fills. The rugae are located within the rugae. Digestive glands, they are located within the rugae. They produce hydrochloric acid and enzymes. Secretions from these glands, coupled with the mechanical churning of the stomach, turn the bolus into semi-liquid form, which is called chyme, that slowly leaves the stomach through the pyloric sphincter to enter the duodenum. And also there is a pyloric sphincter. This regulates the speed and movement of chyme into the small intestine and prohibits backflow. And there is this terminology, peristalsis. There is a coordinated rhythmic muscle contractions for foods propelling through the entire GI tract. Here you can see the anterior view of the stomach, showing muscle layers and rugae of the mucosa. Number 1, esophagus. If the food bolus leaves the esophagus, from the esophagus, the food bolus goes into the stomach, and the first part of the stomach, you can see the fundus of the stomach, and the next one is body and pylorus in the terminal part of the stomach, and then the food bolus is going to the duodenum, which is the first part of the intestines. And also between the duodenum and the pylorus, you can see the pyloric sphincter. And also there are 2 curvatures, lesser curvature and greater curvature. And as for the small intestines, the small intestine is a coiled 20 feet long, which is 6 meters, tube that begins at the pyloric sphincter and extends to the large intestine, in general known as about 7 meters. The small intestine consists of 3 parts: duodenum, the uppermost segment, which is about 25 to 30 centimeters, and the second small intestine is jejunum, which is approximately 2.5 meters, and the last third part of the small intestine is ileum, which is about 3 meters. So the total length of the small intestine is about 6 to 7 meters. And the digestion is completed in the small intestine with the help of additional enzymes and secretions from the pancreas and liver. And nutrients in chyme are absorbed through microscopic finger-like projections called villi to enter the bloodstream and lymphatic system for distribution to the rest of the body. And also, at the terminal end of the small intestine, a sphincter muscle which is called the ileocecal valve. This joins the ileum to the large intestine's cecum. When the sphincter muscle is relaxed, undigested or unabsorbed material from the small intestine is passed to the large intestine to be excreted from the body. And also there is a large intestine, aka which is called colon or large bowel, usually colon. Its size is 1.5 meters, about 5 feet long. The large intestine begins at the ileum and extends to the anus. Actually, in the large intestine, there is no digestion taking place. Mucus is the only secretion in the colon, which lubricates fecal material so it can pass from the body. And the large intestine is divided into 4 major regions. First, cecum. This is a pouch-like structure located below the ileocecal opening. And also, there is the appendix, a worm-like projection projecting downward from the cecum, and also colon, rectum, and anus. The main functions of the large intestine is to absorb water and minerals and eliminate undigested material. And the colons are divided into ascending, transverse, descending, and sigmoid colons. The ascending colon extends from the cecum to the lower border of the liver and turns abruptly to form the hepatic flexure. The colon continues across the abdomen to the left side as the transverse colon curving beneath the lower end of the spleen to form the splenic flexure. As the transverse colon turns downwards, it becomes the descending colon. The descending colon continues until it forms the sigmoid colon. Sigmoid means S-shaped, and the rectum. And the rectum, which is the last part of the GI tract, terminates at the anus. This figure shows the large intestine. Again, from the cecum, there is an appendix to the cecum, and then ascending colon and the hepatic flexure, transverse colon, left splenic flexure, and descending colon, ethmoid colon, sigmoid colon, rectum, and anus. Okay, again, cecum, ascending colon, transverse colon, descending colon, sigmoid colon, rectum, anus. Okay, until now I talked about the small intestine, esophagus, stomach, small intestine, and the colon. Now I'm going to talk about the accessory organs of digestion. Although the liver, gallbladder, and pancreas lie outside the GI tract, they play a vital role in the proper digestion and absorption of nutrients. Figure 6-4 shows the liver, gallbladder, pancreas, and duodenum with associated ducts and blood vessels. Number 1, this is the liver. And number 6, this is a gallbladder. And from the liver, you can see several ducts. They are called the left hepatic duct from the left, and right hepatic duct from the right of the liver. And these two right and left hepatic ducts combined to the hepatic duct, and then a cystic duct from the gallbladder and the hepatic duct from the liver merges into the common bile duct, and then this common bile duct ended at the duodenum. And also you can see the pancreas, and in the pancreas there is a pancreatic duct. Also this pancreatic duct goes into the duodenum, and also you can see the surrounding organs, jejunum, stomach. Okay. And first, the liver. The liver is the largest glandular organ in the body, which is about 5 kilograms. The liver is located beneath the diaphragm in the right upper quadrant of the abdominal cavity. Do you remember the RUQ? The RUQ means the right upper quadrant of the abdomen. And the liver, the main functions of the liver is to produce bile, which is used in the small intestine to emulsify and absorb fats. And the second function is to remove glucose from blood to synthesize glycogen and retain it for later use, and store vitamins such as vitamin B12, A, D, E, and K, and destroy or transform toxic products into less harmful compounds, maintain normal glucose levels in the blood, destroy all the erythrocytes, which are RBCs, and releasing bilirubin. And lastly, this produces various blood proteins such as prothrombin and fibrinogen that aid in blood clotting. Now the next one is pancreas. This is an elongated, somewhat flattened organ that lies posterior and slightly inferior to the stomach. The pancreas performs both endocrine and exocrine functions. First, the endocrine gland secretes insulin directly into the bloodstream to maintain normal blood glucose levels. The endocrine means the glands don't use the duct for the secretion. And the exocrine gland produces digestive enzymes that pass into the duodenum through the pancreatic duct, which extends along the pancreas and together with the hepatic duct from the liver and enters the duodenum. And there are several digestive enzymes produced by the pancreas. First, trypsin, which breaks down proteins. Second one is amylase, which breaks down carbohydrates. And lastly, there is lipase, which breaks down fat. As for the gallbladder, this is a sac-like structure on the inferior surface of the liver. This serves as a storage area for bile. When bile is needed for digestion, the gallbladder releases it into the duodenum through the common bile duct. Bile is also drained from the liver through the right hepatic duct and the left hepatic duct, which eventually from the hepatic duct. And also there is a cystic duct. The cystic duct of the gallbladder merges with the hepatic duct to form the common bile duct, which leads into the duodenum. And the bile production is stimulated by hormone secretions, which are produced in the duodenum as soon as food enters the small intestine. Without bile, fat digestion is not possible. Okay, now I'm going to talk about the medical word elements in the GI system. Here, combining forms. The mouth, oral or stomach, these mean mouth. So oral. Oral means pertaining to the mouth, relating to the mouth. Stomatitis means Stoma means mouth. Itis means inflammation. So, stomatitis means the inflammation of the mouth. Glossling, this means tongue. So, glossectomy means the removal of all or part of the tongue. Book means cheek. Kale, labi, these mean lip. So, caloplasty means surgical repair of a defected of the lip. Dent, odont, they all mean teeth. So dentist means a specialist who diagnoses and treats diseases and disorders of teeth and tissues of the oral cavity. Gingiva means gum. So gingivectomy means the excision of diseased gingival tissue. Cial means saliva. So cialolith means, as I mentioned before, lith, L-I-T-H means stone. So cialolith means calculus from the inner salivary gland or duct. And as for the terminology of the esophagus, pharynx, and stomach, esopha means esophagus, pharyngo, pharynx, gastro, stomach, pylorus, and also small intestines, duodenum means duodenum, and enter, ENTR means intestine. So enteropathy means any intestinal disease. Jejunum means jejunum. Ileo means ileum. And as for the large intestine, append means appendix. So appendectomy means the excision of the appendix. Col or colon mean colon. Colostomy, in here stomy means forming an opening. So colostomy indicates the creation of an opening between the colon and the abdominal wall. And sigmoid, rect, proctor, M. And regarding the accessory organs of digestion, hepat means liver. So hepatomegaly, in here megaly means enlargement. So hepatomegaly means the enlargement of the liver. Pancreas, cholangio means bile vessels. So cholangiole means the small terminal portion of the bile duct. Chol or cholecyst, and chol means bile, but cholecyst means gallbladder. So cholecystectomy means the removal of the gallbladder. Choledocho means the bile duct. So choledocoplasty means the surgical repair of the common bile duct. And as for suffixes, emesis means vomit. So hyperemesis means the excessive vomiting. Iasis means abnormal condition. Megaly means enlargement. And orexia means appetite. So anorexia means without appetite, loss of appetite. Pepsia means digestion. So dyspepsia, this means difficult. So dyspepsia means epigastric discomfort or difficult. Phagia, previously I already talked about phagia, and phagia means swallowing. And so prandial means meal. So postprandial means after eating, following a meal. RRHEA, rhea, means discharge. Dia means through. Diarrhea means abnormally frequent discharge of fecal material. Peri means around. Sub means under. Now, I'm going to talk about pathology. The major symptoms of digestive disorders are nausea, vomiting, bleeding, pain, and weight loss. And also there are clinical signs such as jaundice and edema. These may indicate a hepatic disorder. Gastroenterology is the branch of medicine concerned with digestive diseases, and the gastroenterologist is the physician who specializes in this system. First, ulcer. Ulcer is a circumscribed lesion, open sore of the skin or mucous membrane. So there are important ulcers. Peptic ulcers. Peptic ulcer is the most common type of ulcer that occurs in the digestive system. Peptic, this refers to any part of the body that normally has an acidic lumen or is related to or promotes digestion. There are two main types of peptic ulcers, gastric ulcers and duodenal ulcers. A third type of ulceration is ulcerative colitis. And bacterial infection with Helicobacter pylori is the leading cause of PUD. In here, PUD means peptic ulcer disease. Its spiral shape helps the bacterium burrow into the mucosa, weakening it and making it more susceptible to the action of pepsin and stomach acid. H. pylori releases a toxin that promotes mucosal inflammation and ulceration. There is a treatment for H. pylori, antibiotics and antacids. And also, you need to avoid NSAIDs, non-steroidal anti-inflammatory drugs, caffeine, smoking, and alcohol. These can exacerbate the symptoms of gastric ulcers. PUD develops in the part of the GI tract that are exposed to hydrochloric acid, HCl, and pepsin. And also, there is also formation. The strong action of these digestive products can destroy the protective defenses of the mucous membranes of the stomach and duodenum, causing the lining to erode. Eventually, an ulcer forms. And if the ulcer is left untreated, then the perforation can develop, which is mucosal destruction forms, and it forms a hole in the wall lining. Here, you can see the lesions of duodenal ulcer and gastric ulcer. As you can see here, there are yellowish materials which are exudates from the inflammation of the mucosa, and the mucosa is depressed. These are called ulcers. And also there is ulcerative colitis. This is a chronic inflammatory disease of the large intestine and rectum. Commonly, ulcerative colitis begins in the rectum or sigmoid colon and extends upward into the entire colon. There are several symptoms: profuse watery diarrhea containing varying amounts of blood, mucus, and pus. And this ulcerative colitis is a higher risk of colon cancer. And also, there is another disease, which is hernia. The hernia is a protrusion of any organ, tissue, or structure through the wall of the cavity in which it is naturally contained. In general, this applies to the protrusion of an abdominal organ through the abdominal wall. Here, number 1, this shows inguinal hernia, and number 2, strangulated hernia. Number 3, umbilical hernia. And also, there are the hiatal hernia and the diaphragmatic hernia surrounding the esophagus, the terminal esophagus, and the first part of the stomach. So here, inguinal hernia, strangulated hernia, and umbilical hernia. Hernias in newborn infants or during early childhood. If the defect has not corrected itself by age 2, the deformity can be surgically corrected. And there are two forms of hernia of the diaphragm. The first one is diaphragmatic hernia. This is a congenital disorder, and also hiatal hernia. Hiatal hernia is the lower part of the esophagus and the top of the stomach slides through an opening in the diaphragm into the thorax. So stomach acid backs up into the esophagus, causing heartburn, chest pain, and swallowing difficulty. So hiatal hernia may cause GERD, gastroesophageal reflux disease. And as for bowel obstruction, the bowel twists on itself with occlusion of the blood supply can occur. This occurs most frequently in middle-aged and elderly men. And the accumulation of gas and fluid coupled with loss of blood supply, which is ischemia, in the trapped bowel eventually leads to tissue death, necrosis, perforation, and an inflammation of the peritoneum, which is peritonitis. So surgery is required. And there is this condition, intussusception. Intussusception is telescoping of the intestine within itself. This occurs when one part of the intestine slips into another part located below it, much as a telescope is shortened by pushing one section into the next. This is a rare type of intestinal obstruction, and which is more common in infants, 10 to 15 months of age, than in adults. Usually, surgery is necessary. So this figure shows intussusception. So you can see the ischemia of the tissue because of the intussusception. So the distal small bowel, along with the cecum and appendix, telescoped up into the ascending colon. This condition is called intussusception. And hemorrhoids, these are enlarged veins in the mucous membrane of the anal canal, especially when they bleed, hurt, or itch. Hemorrhoids may occur inside or outside the rectal area, so they are called internal hemorrhoids or external hemorrhoids. They are usually caused by abdominal pressure, such as from straining during bowel movement, pregnancy, and standing or sitting for long periods. Hemorrhoids may also be associated with some disorders of liver or the heart. As for prevention, you need to have a high fiber diet, as well as drinking plenty of water and juices. As for treatment, there is temporary relief by cold compresses, sitz bath, stool softeners, or analgesic ointments, and often surgical removal, which is called the hemorrhoidectomy. Here, you can see the internal hemorrhoids, like this, and the external hemorrhoids at the anal area. Here, you can see the hemorrhoids before the treatment, and you can see also the hemorrhoids after the treatment. And now I'm going to talk about the liver disorders. There is a growing public health concern due to the increasing incidence of viral hepatitis in the US. There is hepatitis A. This is the most common cause of hepatitis. And the most common causes of hepatitis are ingestion of contaminated food, water, or milk. But as for hepatitis B, these are usually transmitted by routes other than the mouth, such as from blood transfusions and sexual contacts. And jaundice is one of the major symptoms of many liver disorders, including hepatitis and cirrhosis. Jaundice means a yellowing of the skin. Why? Because the liver is no longer able to remove bilirubin, a yellow product formed when erythrocytes are destroyed. Erythrocytes means RBCs, red blood cells. Bilirubin appears in the skin and mucous membranes, aka icterus. Jaundice may also result when the bile duct is blocked, causing bile to enter the bloodstream. Here, you can see the jaundice face. And diverticulosis, this is a condition in which small blister-like pockets in the inner lining of the large intestine. And there are several signs and symptoms. Pain usually in the LLQ of the abdomen. LLQ means left to lower quadrant. or extreme constipation or diarrhea, fever, abdominal swelling, and occasional blood. As for treatment, bed rest, antibiotics, and the soft diet are necessary. And also, in some cases, for severe cases, there is an excision of the diverticulum, which is called the diverticulectomy. Here, you can see the diverticulosis. Oncology, stomach cancer. As for the oncology of the GI system, in Korea, the stomach cancer is very, very common, but this is rare in the United States, in the Western countries. Mostly, gastric adenocarcinoma is the most common form. And also there are other types of GI carcinomas: esophageal cancer, hepatocellular cancer, and pancreatic cancer. Carcinomas are cancer. And colorectal cancer arises from the epithelial lining of the large intestine. And now I'm going to talk about the diagnostic, symptomatic, and related terms. Anorexia means lack of or loss of appetite. Appendicitis is inflammation of the appendix. Ascites means accumulation of serous fluid in the abdomen. Maybe if you have any liver diseases, these ascites can occur. And cachexia is a general lack of nutrition and wasting. Here you can see the appendectomy. If you have appendicitis in the appendix, this surgery can be done. This figure B shows the incision site, and C shows the excision of diseased appendix. This is called appendectomy. Cholelithiasis means presence of formation of gallstones in the gallbladder. And cirrhosis means chronic, irreversible, degenerative disease of the liver. Calling means a spasm in any hollow or tubular soft organ accompanied by pain, especially in the colon. Deglutition means the act of swallowing. This figure shows the sites of gallstones. Gallstones can occur in the gallbladder and also the cystic duct and hepatic duct and the common bile duct. Dyspepsia means epigastric discomfort felt after eating. Dysphagia means inability or difficulty in swallowing. Fecalis means fecal concretion. Flatus is the gas in the GI tract. GERD, gastroesophageal reflux disease, backflow of gastric contents into the esophagus. Halitosis means bad breath. Hematemesis means vomiting of blood. IBS means irritable bowel syndrome. In this condition, you will have diarrhea or constipation or a recurrence of each symptom or mixed. Malabsorption syndrome. Oral leukoplakia means formation of white spots on the mucous membrane of the tongue, lips, or cheek. Melena means passage of dark colored stools. Peristalsis is progressive wave-like movement in the GI tract. Pyloric stenosis means stricture or narrowing of the pyloric orifice. Regurgitation means backward flowing to the mouth from the stomach. Steatorrhea means passage of fat in the feces. And I'm going to talk about diagnostic and therapeutic procedures. Endoscopy. Endoscopy means visual examination of a cavity or canal using a specialized lighted instrument called an endoscope, upper GI and lower GI endoscopy. Here you can see the colonoscopy and the sigmoidoscopy. from the anus go into the colon inside to the cecum. And there are several terminal terms regarding the diagnostic and therapeutic procedures. Laboratory hepatitis panel. This is a panel of blood tests that identify the specific virus, hepatitis A, B, or C. Liver function test, abbreviation is LFT. Tests involving measurement of the levels of certain enzymes, bilirubin, and various proteins for liver function. Serum bilirubin, stool culture, stool guaya. This shows the barium enema, barium swallow, cholecystography. Also, previously mentioned about CT. CT means computed tomography scan. And ERCP means endoscopic retrograde cholangiopancreatography. In here, cholangio means bile vessel or bile. So this means endoscopic procedure that provides radiographic visualization of the bile and the pancreatic duct. And also PTC, percutaneous transhepatic cholangiography. This is radiographic examination of the structure of the bile duct. Scalography is radiologic examination of the salivary glands and duct. US means ultrasonography. And surgical biopsy. This term was already covered. Biopsy. Nasogastric intubation. This is an insertion of a nasogastric tube through the nose into the stomach to relieve gastric distension by removing gas, gastric secretions, or food. And the surgical procedure terminology is anastomosis, means surgical joining of two ducts, vessels, or bowel segments to allow flow from one to another. Colostomy. In here, stomy means forming an opening. Col means colon. So colostomy means creation of an opening of some portion of the colon through the abdominal wall to its outside surface in order to divert fecal flow to a colostomy bag. Lithotripsy. Lith means stone. Trips means crushing. Here you can see you can see the colostomy. This shows the procedure. Figure A, this is a healthy colon, but figure B shows intestinal obstruction. In this case, the surgeon excises a diseased colon, and the colostomy is performed to attach healthy tissue to abdomen. As you can see stoma going out to the skin. So in here you can see the colostomy bag attached to the stoma. Polypectomy means excision of a polyp. Polyp means a small protruding mass. Pyloromyotomy means incision of the longitudinal and circular muscles of the pylorus. As for pharmacology, there are various pharmaceutical agents available to counteract abnormal conditions that occur in the GI tract. Antacids, these counteract or decrease excessive stomach acid. Antidiarrheals and antiemetics can be used. And as for increasing or decreasing peristalsis, there are several medications. Antispasmodics is to relieve cramping, and also there are these drugs to help in the movement of material through a sluggish bowel. These are called the laxatives. So this table shows drugs used to treat digestive disorders: antacids, antidiarrheals, antiemetics. This controls nausea and vomiting. Antispasmodics and laxatives. Okay, this is the end of this lecture. Abbreviations. ABC, aspiration biopsy cytology. ALT, AST, these are liver enzymes, alanine aminotransferase, and AST, aspartate aminotransferase. BA means barium. CT, computed tomography. CT scan oral, which is called CAT scan. EGD means esophagogastroduodenoscopy. ERCP, endoscopic retrograde cholangiopancreatography. GB, gallbladder. GERD, gastroesophageal reflux disease. GI, gastrointestinal. HAV, BV, CB, DV, EV, these are all hepatitis, the types of hepatitis viruses. And IBS means irritable bowel syndrome. PUD, peptic ulcer disease. R/O means rule out. AC means before meals. BID means twice a day. MPO means nothing by mouth, fasting. PC or PP, after meals, postprandial. PO means by mouth, per oath. PRM means as required. QM means every morning. QH every hour. Q2H every 2 hours. QID means 4 times a day. QOD means every other day. QN means every night. STAT means immediately. TID 3 times a day. Okay, that's it. So in the next video, I'm going to talk about respiratory system. See you again.